A middle ear infection, also called an acute otitis media, is one of the most common childhood infections. In fact, half of all children will have at least one ear infection by the time they're a year of age. With an ear infection, the middle ear becomes inflamed and often collects fluid. What happens is germs enter the middle ear through the eustachian tube, which is a tube that connects the middle ear to the back of the nose and throat. And oftentimes that tube will then get clogged and those germs will multiply, and in the body's attempt to fight infection creates fluid and inflammation, which can cause redness, swelling, and pain. Congestion from colds or allergies can often plug that eustachian tube and allow those bacteria or viruses to multiply, and that's what essentially causes an ear infection. Some of the symptoms of an ear infection include pain if the child is old enough to indicate that. If they're not, they may just pull at the ear or rub at the ear to show some signs of pain. They'll often have an associated fever and cold or cough symptoms as well as that. They may not sleep quite as well, they may not eat as well. So if your child is showing any of those symptoms, I would definitely take them to see your primary care physician. There will be certain signs of an ear infection. With a normal eardrum, the color is kind of a pinkish gray, there's no fluid seen behind it, you can see the bones clearly behind the eardrum. But when you look at an infected ear, there will often be redness. You can see more of the vessels. There will be some fluid likely behind there. That could be clear fluid or pussy looking fluid. And you may not be able to see the bones like you usually do. The good news is that most ear infections, the body is able to fight on its own. But you need to make that decision with your primary care provider, because there are some ear infections and some children who are at more risk for progressing to a more serious infection, such as meningitis or mastoiditis, which is an infection of the bone and the sinuses behind the ear. And only you, with your primary care physician, can decide if your child is at risk for those things. So for some children, the necessary treatment might just be some pain medication, some topical or oral pain medication, and following them closely to see if it resolves on its own. For other children, treatment will include an antibiotic. Well, there's no way to completely prevent an ear infection, but there are some things that we know predispose to ear infections. One of those is smoke exposure. So you should never smoke, that is cigarette smoke, tobacco smoke, around your child directly. Certainly not in the house, in the car, or right next to them. Another risk factor for ear infections is feeding your child laying down. You should never prop a bottle in your child's mouth because they're more prone to having bacteria enter that middle ear through a propped bottle when they're lying flat. So the best way to feed a child is somewhat upright. Whenever possible, of course, you should limit your child's exposure to other sick children. And there are numerous vaccinations that actually help prevent ear infections now. So you should always consider getting your child up to date on their vaccinations. We also know that breastfeeding can decrease the risk of a child developing ear infections over time. So that's just one of the many reasons to encourage breastfeeding, and it is truly the best option for infant nutrition. There are numerous sources out there for information about ear infections and health topics, but one place I would direct you is to Saint Alphonsus's website. There is a health encyclopedia there with numerous health topics, including ear infections, diagrams, and more information. In addition to looking at websites, you should definitely talk to your primary care provider if you have any questions. We at Saint Alphonsus and the Eagle Health Plaza are accepting new patients and we'll be happy to answer any questions that you might have as well.